And if you wouldn't mind, put your contact information in the chat, and then that way we can follow up with you after the meeting today. And feel free to ask a question, put questions in the chat as well as we're going through the meeting, and then we can make sure to get to all of your questions. So your community cares, the reason we're having this lunch and learn today, it's all been made possible by the Northwest Connecticut Community Foundation. They gave us some funding to be able to enroll residents that want to be volunteers to help their neighbors and to enroll people that need help. So we're concentrating on the towns specifically, Barkhamsted, Bethlehem, I have to read it off because it's a long list, Canaan, Colebrook, Cornwall, Goshen, Heartland, Harwinton, Kent, Litchfield, Morris, New Hartford, Norfolk, North Canaan, Salisbury, Sharon, Torrington, Warren, Washington, and Winchester. So we're really excited on all of you being here to hear more, and to our guest speakers for being here. Leonardo Gio is here. He is the Rural Healthcare Resource Coordinator at the Northwest Hills Council of Governments. And Patricia, the Public Health Nurse at the Torrington Area Health District. So thank you both for being here today. And Leo, why don't you get us started?
Sure. Thanks, Michelle. Good afternoon, everyone. I know many of you here, although I do see some new faces. So I'm Leo. I work with the Northwest Hills Council of Governments as their Rural Healthcare Resource Coordinator. We appreciate all of you being here today to learn a little bit more about your community cares. And I've had past experience with Michelle and the organization as well. So I'm happy to be here and just kind of, support them in their endeavor here in Litchfield County. So why don't we just go through everyone, maybe do a brief introduction, and we'll start with Patty from Torrington Area Health District.
Hi everyone, my name is Patty McGlowitz. I'm the public health nurse here at Torrington Area Health District, and I am excited to be here.
Thank you, Patty. I have Irene next on my screen.
Hi everyone, my name is Irene Knoll and I'm the Director of Helping Hands Shore Service.
Thank you, Irene. How about Queen?
Hi, my name is Queen and I work with Michelle.
Hi, Queen.
Hi.
Tina Prince?
Yes, hi, my name is Tina. I work with Michelle as well.
Thank you. Preston?
Hi, everyone. I'm Preston Wilbur. I work with Michelle through the Maturity Works program.
Thank you. Tara?
Hi, everyone. I'm Tara Monroy. I'm the manager of the Community Health Workers at Community Health and Wellness Center in Torrington.
Thank you. Sandy? If you're able. How about Michael?
Mike Volstead, I'm a board member at Shore Service in the Northwest corner.
Excellent. Pam, Salvation Army.
Good morning. You just said who I am. I'm
I'm
Pam
sorry,
with
I know.
the Salvation Army in Winstead. I also represent the Salvation Army up in the 6 towns, actually 8 towns up in the Northwest corner.
Thanks, Pam. I stole your thunder there, sorry. Sam Brady.
Hi, my name is Sam. I'm from Community Health and Wellness. I'm a community health worker with Tara.
Thanks, Sam. Jennifer Kelly.
Hi, I'm Jennifer Kelly. I'm the Winstead Senior Center Director.
Thanks. Robert Morzella.
Hello. Hi, I'm Rob Morzella. I'm a pastor at Friendship Baptist Church. And I'm actually here with some of our interns on my left and right.
Awesome. Thanks, Rob. Aaron in Goshen. Uh-oh. Technical difficulties. Okay. We'll come back. Malia.
Yikes. Hi. I'm over in Sharon and I'm the social service director here.
Thanks, Malia.
My name's Malia. Yeah.
Michael Lynn. Heather Matthews.
Heather Matthews, community health worker, community health and wellness.
Thank you. Barbara.
Barbara McClokin, I'm an RN. Patty had invited me I'm doing a project for my BSN on older adults and their issues in the community.
Excellent. Carol Anderson. How about Paul Rabouf?
I am Paul Rabouf. I'm doing some regional health, public health emergency preparedness, and I work with Patty.
Thank you, Paul. And there's a couple people on here. Oh, here we go. Teresa. How about Pam Tino?
Good afternoon, Pamela Tino for Charlotte Hungerford Hospital. I'm the Community Health and Development Specialist.
Thank you, Pam. Teresa, I see your chat. That's Teresa Snyder-Graney from Falls Village Social Services. And also Michael Lynn is having some technical difficulties with Litchfield Social Services. And I'm familiar, Erin, who I don't know if she had problems before with the mic. Erin, you there? Erin's from Goshen Community Care and Hospice. And then I see just a couple of people that don't have a name. So if I missed you, please introduce yourselves.
Hi, Bushra. I work for Michelle. I'm with Maturity Works.
Thank you.
Hi, my name is Thikra. I also work with Michelle through Maturity Works.
Thank you, Dickra. I'm sorry. I didn't know if that was a name or initials. I apologize.
That was my name, Thikra.
Got it.
I am Sandy Papson. I'm the secretary at St. Kateri Parish, which encompasses the Church of St. Bridget in Cornwall Bridge, St. Bernard in Sharon, and Sacred Heart in Kent.
That's excellent. Glad you're here. Anyone else? All right, Michelle, back to you.
All right, I'm MD Birmingham. I'm the co-founder of Your Community Cares. And it's wonderful to see everybody here.
Yeah, we're thankful everybody came today to listen in on our presentation, and then we're going to go over the website and then listen to our guest speakers as well. So let's get started. I'm going to share my screen and everybody can see the presentation. Right, Leo?
Yep.
Okay.
Okay. So what is your community cares in Northwest Connecticut?
Well, MD, thanks for that question. Your Community Cares is a way for basically volunteers to get involved in their community. They can help seniors and people with disabilities and all of the towns that we previously mentioned. MD and I founded Your Community Cares in 2019. And I was a physical therapist and still am a physical therapist for the last 20 years. And I took that knowledge and that passion from wanting to help people and started this nonprofit organization. And, you know, what I saw in people's homes when I would leave them was that they just needed more assistance. It wasn't that they needed, you know, they needed help taking out their trash or folding the laundry or getting the laundry, these little things, these little chores that other people could simply help them with. So this picture is Joe. And can everyone see Joe? MD, okay. Can you tell us a little bit more about Joe?
Small, medium, or large? Large. Pick the biggest one in there.
So Joe is Joe's a community member. He's age 70, going on 71. But typically the requirements to be a community member is age 70 plus. Or 18 plus with a physical disability. And excuse me. So Joe does meet the requirements of age-wise for being a community member. And let's say he has difficulty taking out his garbage. And for most people, that's, a fairly simple task. But for someone like him, that's almost like running, Olympic marathon. It's a big deal. And there's so many things involved in just wheeling it out from fear of falling and so forth. So that does play a large role in something so simple.
Does anyone know somebody like Joe in your neighborhood? Somebody that, could probably use a little extra help? Does anybody have Preston, do you have somebody that you can think of that might need a little extra help that's in your community or neighborhood?
Yeah, Michelle, I definitely do. I have people that are older than I am that can't move very well, and definitely have people that could use help from someone.
Yeah, we know it exists in many, many communities. So thanks for sharing that.
And what can people like Joe ask of from a volunteer?
Well, there's so many categories. When people go to the website, they can pick the category that they're interested in. So a volunteer, when they sign up, picks they're going to want to only help with yard work, or they only want to do transportation and bring people to doctor's appointments, or they're only going to want to do housework and organization or things around the house. So they pick the category. They could just be a companion, and that's a really important category because so many people just want somebody to talk to. So are there other examples you can think of, MD?
Sure, like, a lot of individuals, their pets are like extensions of the family. And they might opt to miss appointments that are fairly critical. But that's because, they don't have someone to look after their pet. So they're not going to opt to go, but also things like relief, to primary caregivers, and then transportation to medical appointments as well.
That's true. Yeah, I forgot those. So we're really focusing on individuals that are over the age of 70 or over the age of 18 with a physical disability. Those are our basic, two buckets of people that we help with. And they can either enroll online on our website, yourcommunitycares.org, or they can call us if they don't have access to technology, and they can get signed up that way. If you are a senior center or a church and you wanted to enroll multiple people, churches are a great opportunity to volunteer together. And they could become a partner on our website on the partner tab. That's where you would sign up, and we'll go over that in just a minute. And then once we do a background check, once people are enrolled, we do a background check on all the participants. And that's really important for the safety and security of the users of the website. And then they would, go to the website whenever they need help. They would then put in the request directly on the website, and an email goes out to the volunteer. So who are the volunteers? The volunteers are individuals over the age of 15 that from 15 to 17, they would have parental consent and supervision. Anyone over the age of 18 would have a background check. So volunteers do the same thing. They enroll online and they can do that as an individual or in a group setting, like a business could be a group, a church, you know, a nonprofit. If you've got the Lions Club, the Elks, you know, the Masons, and any type of club like that, or colleges, if they want to all go in a group, or a high school, they could enroll together. And then others individual. And then they do they put in their application online, we do the background check, and again, they get accepted, they'll get an email letting them know they've been accepted. And then they would be able to see all the volunteer opportunities that are available to them. But they do not do any personal care or licensed work. So there's no showering, no electrical or, you know, plumbing work, anything like that. Anything else we should add, MD, before we go check out the website?
Yeah, you know, regarding, let's say if someone's tree is down in their backyard, chances are, obviously, our volunteers aren't going to be the ones doing that work, but we could connect with a local company that may want to, you know, do the work as either reduce costs or as a donation, a charitable donation to our organization. And, you know, that's a really good way to connect local businesses within their community as well. So
Yeah, and it's getting a bigger and bigger priority for communities to support this demographic of people, because there's 10,000 people turning 65 every day. So in the world, there's more older people than younger people. And so how are we going to continue to support people that are on a fixed income and are unable to pay for private caregivers? Plus, there's less private caregivers in the world, as there's less people in the workforce today. So we're preparing for the next 5 to 10 to 15 to 20 years, and how are we going to really come together to help support one another?
You know,
And the website allows for any community, it's scalable to allow any community to then let your town departments know, let your churches know, let your religious organizations know, your colleges and high schools, so people can get more involved, and it centralizes the way that people can get help.
you know, approximately 50% of every town's tax budget goes towards public education. So now, as Michelle said, we have this population that is now competing for, you know, help with services and so forth. And whereas this, you know, how are we gonna do this economically? So, you know, something like your community cares really helps provide that bridge at no cost.
Yeah, and the funding that's provided to us allows us to enroll individuals in certain towns. So when we started the organization, we thought, you know, we were going to try to keep this free for people, and we are, but we right now are focusing specifically on the towns that we have funding in. So from the Northwest Connecticut Community Foundation, and we are trying to list on our website all of the different towns that we're serving and the funding that we have, so that we can make it clear for people of how they can, what towns we're focusing on, because so many people are asking for help, and we have to make sure that we have the funding behind us to make this grow. So before we go on, were there any questions that anybody wanted to ask before we start to go over the website? Please unmute yourself and just ask, or if there's anything in the chat, Leo or Tina, please let us know.
I'm wondering if you have printed materials, because many of the seniors that we currently work with do not have access to the internet. And printed materials might be helpful for them to pick up in various locations or have delivered to them, so that they can understand what the program is as well.
Absolutely. Yeah. If you just put in the chat where you wanted it to be, you know, dropped off, or that we could have a call after this to discuss that. But yeah, we have like these tearaway, it's almost like a script pad that a doctor's office has, tearaway pad. And that's an easy way. You could have a whole, stack of them, and you can just kind of give away at a location.
Wonderful. I will do that. Thank you.
Sure. Yeah. And some towns put them in the food pantry bags, so it could be a resource anyway. Any other questions? We've got tons of things and actually on our website, if you, on the updates tab, there's printed material here. So anything that you might be interested in, the tearaways are down here. So you could click on this and then you could print it, but that's for like a larger, I have the smaller tearaways that I could provide. Anybody else have any questions? Okay, so on the BA partner page on the tab of our website, this is where the partners sign up in groups. So this is where, a healthcare entity, Hartford Healthcare, so they have, they're a partner and they enroll people, their patients across Connecticut that don't have access to the internet, and they schedule those things that they need help for. ECHN, there's all different partners that we have that are enrolling people that don't have the internet, and then they call you as the point of contact, and then you enroll them. And then they call you when they need, if they need a ride on a Friday, you put the request in right on the website. It's really simple to do.
Those deeds can be scheduled ahead of time also. So it doesn't have to be, like an on-demand type situation. It could be scheduled in advance.
Yep. So anybody that's an individual would go to the sign up button to sign up. Otherwise, if you want to be a partner, you'd go to the partner page and that's where you would sign up. Once you're registered, you would log in. I'll just, so you'd have your username and your password, you would sign in. And this is where you would schedule those things that people are requesting help with. So this pink button that says schedule community deed, you'd click this pink button and I'll show you how quick and easy it is to, if Joe called me and said, I need a ride to the doctor on Friday, you're going to put in the day. All right, Joe, what time is it? It's at 10 o'clock. Call Joe to discuss, or, you can put in whatever you want to say there. Transportation, he's asking for transportation and medical appointment. And then you're going to look at your list, your full list here of all these people that you're helping, and you're going to click that person's name and submit, and that's it. And that email will then go to all the volunteers that are within 15 miles of Joe's house. So the email goes out and then the first volunteer that signs up for it gets it. So they accept it, that person, you'll get an email letting you know that that person has accepted it. And then you can let Joe that the person's name and phone number, and they can work out the details. So we've really tried to make this easy and user-friendly. If somebody was calling you and didn't care what time it wasn't a doctor's appointment, you could put any time. Say it was yard work, and you would just pick the subcategory, whether it's, mowing the lawn or doing the gardens, whatever it is, so that the volunteers know what would be expected of them. But we really are just the conduit, the connector of the two parties, and then the two parties work out the details.
So once they put in their deed request, it goes out to all the volunteers in that town and within the 15-mile radius of their house. So that way, like Michelle said, it is first come, first serve. And once the person selects to do the task, and it closes it out. So other volunteers will know that it's no longer available. Sometimes some community members will put in, they may add a name, request for Pam. And most volunteers will see that and they will not accept the date because they're anticipating Pam's gonna take the opportunity. And that's another thing, bonds get created with community members and volunteers.
Yep, and the real friendships come out of it, which is great to see that, we have one volunteer that, she goes every single week to this person's house. I mean, we have multiple that do that, but this one relationship with Pam, and it's just awesome to hear the stories of these friendships that have been created. But once you create a profile, you would then go down, you would see your deeds history. Deeds are all the good deeds, all the good things that people are doing for one another. You would see your upcoming deeds. Those are the things that you've put in, requested for other people. Or if you were a volunteer, this is still how your account would look. And you could see what deeds you signed up for, what you've done in the past. And so you could be tracking that. Say you were, needed volunteer hours for college or high school or for whatever it was. You would see all that right in your profile. So does anybody have any questions on the website or would like more information on anything on the website? Please don't hesitate to stop me. All right, so let's
Can
go.
I just ask a quick question? Sure. Okay. Say I'm a community partner and I send out a request that Bob would like a ride. Say I send out the request on a Friday that Bob needs a ride of Saturday, and I'm not here to get the email. Is there a way that ahead of time you can have the volunteer call that person that to let them know that he or she's accepting to give that Bob a ride?
So when you put in the request on that purpose line, that's where you would put call Bob or call, whoever to schedule. So
Okay.
that you can put the onus on the volunteer that they're responsible for connecting, because you're not going to be there every day of the week, and we understand. So that's why on the purpose line, it's really important to notify the volunteer to contact that person to get it off of your shoulders.
And
Great. Okay.
And usually most times when things like that happen, volunteers will contact the community member just to, to verify whether it's a meeting time or if if there's anything that they should know in advance, or just to have that upfront communication. They usually tend to do that. But like Michelle said, if it's something specification, then absolutely put in the purpose section just to, make sure that it happens as desired.
Okay, thank you.
One of the things I also want to add to that is, as I was saying before, bonds do form, and people do tend to, they might want to schedule things or, do things off of our platform, and that's great. We know that will happen, and it has happened. But one of the key things to keep in mind is by scheduling it through our platform, it also gives the guarantee of insurance. And that's a very vital factor.
Yeah, these friendships happen, but we encourage people to put in the request online so we can keep this all documented. Like for these grants, right? We're supposed to be signing up people, having the deeds happen. Well, it's only trackable if it's in our system. So we really are encouraging people. That's great, become friends, but still put in the deed request on the website, and then that person can then contact them and they can work out the details, but it should be scheduled in the website. Tina, did you have a question?
I have a question in the chat box. It is stating, can you share information about security of people's social security numbers? Seniors are very leery about sharing their social security numbers.
Yep. So the only way to do a background check is through a security system. I mean, excuse me, through a social security number. We need a full name, we need somebody's date of birth and their social. So I understand that, you know, if people don't feel comfortable, then we're not the program for them, because we background check everybody that comes in. So we have the highest level of security on our website. We are HIPAA compliant. We are as secure as possible. And as soon as that background check clears, then their social security is wiped from our system. So we have taken precautions to have the most secure website possible.
So the social security number is not really going into a database for us or anything like that. It's just for the background check to the company directly.
Yep, and it will be wiped out as soon as possible. Any other reactions people have or questions? All right. So what are the benefits of your community cares? You know, behind the scenes, and the folks that are on the call today, we've got Tina and Preston and Queen and Bushra and Dykra and Janice and Maria and even more people that I can't even think of right now. All these people that are helping us behind the scenes, because when we apply for a grant, we now want to network, like all the people on the call today. We want to get in front of the people in these communities to reach, build the town spreadsheets, do outreach. So you might be getting calls from some of these Maturity Works trainees that are on the call today, because we want to try to drop off flyers, have presentations, get more feet on the ground in these towns so that we can be successful and get the word out, because we know not everybody has the internet, and we want to meet people where they are. We want to drop those flyers, or we want to sign them up online. Wherever they are, we want to meet them there and try to help better connect Northwest Connecticut towns. And there's no cost. That's the beauty of all this. There's no cost. The funding allows this to be free.
Yeah.
So,
Now that we've, you know, discussed the participant and the town benefits, can you tell us about a success story?
well, this is June and Beth are an example of a success story. I mean, they get together almost every week, and Beth, we're actually going to be filming them next week for this, we do a lot of public access TV shows. So you might be seeing us on some of your channels, or if you know of a channel that we might be able to get on, but we have a YouTube channel and we've been able to highlight some of these successes.
You know, and now that you know some of the details of your community cares, only one question really remains.
So we want people to get involved. We want people to call us, invite us, help us get the word out, because we know there's so many people in need and people that want to do good things. So we're really excited that, you know, you're here today, and we're anxious to continue to network. So I'm going to jump over to Patty and Leo, and we can continue on with having our guest speakers, and then we can follow up with questions at the end.
So I think I would just like to echo, you know, Michelle, I think you said before that Connecticut is aging, and but specifically Litchfield County is aging. I think we know that the property values here they're high, not good for young families starting out. Not a lot of fun things to do per se. I mean, I love Litchfield County, but not everybody does like that rural area. So so there's a lot of things that just create that aging population to happen more quickly here in Litchfield County. So I think it's really important that we lean on that civic lift to assist those people to remain living independently at home. And I'm a big proponent of this too, just from a personal standpoint, because I started the New Milford Chore Services in New Milford back in 2016. So I saw firsthand, you know, how much value it really adds to the community to offer this type of volunteer service to help people achieve those things that they need to do. It's, you know, just activities of daily living and keeping up the maintenance of their property and their dignity too. So those are my thoughts.
Absolutely. Thanks, Leo. And Patty, love to hear from you.
Sure, I will share my slide. Okay, can everybody see?
Yes.
Okay, so I am the public health nurse at Torrington Area Health District, which provides provides health services information to 20 cities, towns, and boroughs within the northwest corner of Connecticut. And our goal is to promote and to protect the physical and environmental well-being of the citizens through direct services, wellness and promotion programs, and community efforts. And I will just talk about a few of the health promote wellness and promotion programs that we have right now. So currently we have the Prevent Type 2 Diabetes program, which we are running in the Winstead Senior Center. It is a 1-year-long program. It is cost effective. It is evidence-based. It is proven to delay and prevent type 2 diabetes. The Torrington area staff are trained, and basically participants are, participants are expected to achieve weight loss by eating well and being active. The goal is to lose 5 to 7% of your starting weight and to get 150 minutes of physical activity every week. We also have a few suicide prevention grants, which is one of them is QPR, which is question, persuade, refer. We all know that we are experiencing a mental health crisis, and people of all ages are affected. And QPR is basically like CPR. It's an emergency response to someone in crisis with early recognition of warning signs and early intervention. So we hold QPR training for community members or anybody that would like to be involved. We also have a CDC comprehensive prevention program that is running for 5 years, and Connecticut was one of the 11 recipients of this grant, and it is a comprehensive public health approach to suicide prevention with attention to vulnerable populations. So the call center is focusing on the middle and high school students, and we are focusing more on the older population. We also have chronic disease self-management. So if you have diabetes, depression, anxiety, arthritis, anything like that, or you're caring for someone with these types of conditions, this is a 6-week course to help with the ongoing health condition. Matter of balance, that is basically a fall prevention program, and together with Farmington Valley Health District, we offer coach training for staff from area assisted living facilities and the community to become certified in the Matter of Balance program, and participants basically learn how to prevent falls and make changes in the home to reduce falls. And by increasing their activity and exercise, they get more strength and balance, which improves their results, and basically they're more confident and they reduce their risk of falls. The opioid and medication drug overdose prevention, I can do multiple slides on this. So the for sake of time, I won't go too much into depth with this, but basically, right now we are doing Narcan distribution to schools, and then we will also be doing Narcan distribution to community partners. We collaborate with local agencies. This is a all hands on deck kind of program, and we do a lot of outreach, education, harm reduction, drug take back day, things like that. We teach CPR, first aid, stop the bleed courses here at TAHD. So if anybody would be interested, we do those as well. Immunizations, influenza, we start in October, as well as we have COVID-19 clinics. We vaccinated almost 11,000 people with the help of the MRC, Medical Reserve Corps, CERT, Community Emergency Response Team, and volunteers. We also did some homebound vaccinations with Community Health and Wellness, New Opportunities in Charlotte Hungerford. We also have the Connecticut Vaccines for Children program, which basically work with providers to increase immunization rates and try to catch them up on immunizations that were missed during the pandemic. And lead poisoning prevention is another thing that we do. So this is from actually a community needs assessment from 2021 from Charlotte Hungerford Hospital. And I just wanted to, I feel I like to look at numbers and see where we're at. And so comparatively, there's a high prevalence of obesity in Torrington and in Litchfield County. And if you look at primary care physicians, dentists, and the one that really is alarming is the mental health providers. So here in Litchfield County, our value is 250.7, where the benchmark for peer communities is 357. So we really have a lot fewer healthcare providers, physicians, dentists in Litchfield County. And then aged and the suicide rate also is above average. So just some takeaways. Basically, mental health is a significant concern. Prevalence of depression, anxiety, and severe mental health conditions are rising. Isolation is affecting mental health, physical health, particularly for rural and elderly residents. The opioid epidemic is significant with rising use of opioids. Alcohol abuse is also a problem. Low-income, rural, and elderly populations are particularly vulnerable to transportation issues, food insecurity and access to healthy foods due to financial barriers, transportation issues, and of course, the COVID-19 pandemic has continued to contribute to the significant rise in food insecurity. So putting it all together, bridging the gap basically, and I feel like your community cares can help do that. And just by using one example of your volunteers providing companionship for the elderly population, and of course that would decrease depression, decrease isolation, increase cognitive function, quality of life, socialization, which ultimately would just improve mental and physical health for our community. And that's it.
That's awesome. That's really so important to be able to show from a health perspective why your community cares can really impact so many people. So thank you for that. That is vital to understand the needs in these communities, and hearing that transportation and companionship are one of our categories that volunteers can help support people, and that goes hand in hand of the needs. And so we just have to get the word out and get people, residents, to become volunteers and try to get this message out that it's so important. Did anyone have any questions for Patty?
I know I went through a lot. I'm sorry. If anybody has any questions, you could always contact me on the side.
No, that's great information. So again, any questions about your community cares? The takeaway from today is hopefully that you're going to tell someone else. And that's what this is all about, is sharing information so that even the information that Patty just showed is really important, that they're seeing that more people are needing help. And this is just where we know that 10,000 people are turning 65 every day, right? We already discussed that. So we know that this is going to become a bigger and bigger problem. So I think that everybody on this call today is interested in helping this demographic of people. And then if we can then just share it with others, that will be really important. So I wanted to share just one more thing. This is when I talk about us being, creating some content and doing some videos.
There are many older adults and people with physical disabilities who need help to remain independent at home. People are living longer, and many are struggling to get everyday chores done on an ongoing basis, unable to pay for because 10,000 people are turning 65 every day. And with fewer people in the workforce, neighbors will need to rely on free volunteer support in their neighborhood. People are not seen because they are behind closed doors. For those in the aging and disabled community that may be unwilling to ask for help, the message would include, everyone needs help sometimes, and it's okay to ask for help. Acts of kindness are needed in every town. We are online at yourcommunitycares.org, where we have additional information about the benefits of helping someone in your town.
So I just wanted to share that with you. Our social media, we have YouTube and Instagram and, all that good stuff. But I think that type of messaging, getting the word out to just general people that aren't tuned in to this discussion, is really who we're trying to reach. So we welcome any opportunities to partner and collaborate in the future.
Yeah, we definitely have a two-pronged approach of how we integrate with towns, and we've talked about the organic way of how we network with individuals, and we also have the community assistance team approach, and that's where we network with the Human Services Department, along with for the community member side of people requesting help, and also usually with the police department for the volunteer side of things. And they tend to have a pool of auxiliary volunteers, or there might be a high school youth group as well. So that's something that we've established in Clinton, and we're looking to expand into other towns as well.
Yeah, we have a variety of grants in different towns. So the town of Southington, their police department just put us on their website. It's a really great way to educate the public of different nonprofit opportunities, and we're happy to, try to get more involved in Litchfield County, and we're really excited that you guys joined us today. Leo or Patty, do you have any other questions or thoughts before we close today?
I don't think anything on my end, but certainly I'll be sharing your community cares, and I hope that everyone else does too.
Great, thank you.